Let's go over foods that can increase your risk of kidney stones. I get asked all the time, is sweet tea in the South bad for causing kidney stones? And believe it or not, when it comes to dietary recommendations about kidney stones, that's way low on my priority list. So, the most common type of stone is a calcium oxalate stone. But because of the way calcium interacts with oxalate in the gut, a low calcium diet actually increases your risk of kidney stones instead of decreasing your risk of calcium oxalate stones. So, focusing on the oxalate is where it's at. And the reason people ask about sweet tea or other forms of tea is tea does have some oxalate, but a glass of tea probably has 10 to 20 milligrams of oxalate. Guess how much a cup of cooked spinach has? Over 1,000. So, leafy greens, which are actually really good for you, like spinach, kale, rhubarb is really high in oxalate content, okra is super high in oxalate content. And what I tell patients is these foods are very good for you, but they do contain a lot of oxalates. So if you do have a history of calcium oxalate stones, it isn't that you need to cut out these foods, it's you need to think about how much you're consuming. So if you make a stone every other year, maybe a daily spinach salad isn't the best idea. So, if you are going to focus on reducing your oxalate consumption, think about these leafy greens. You can look up lists online that give you the exact milligrams of oxalate in certain food categories. But when it comes to behavioral modification for kidney stones, hydration, hydration, hydration. If you're adequately hydrating and you're still making kidney stones, that's when you start looking at more dietary modifications, which can be more significant, and considering pharmacologic therapy like potassium citrate to decrease your risk of kidney stone formation.